National Rural Health Conference, I have with me Chelsea Willmott. Chelsea, welcome.
Thank you.
I hear we're going to have a very interesting talk from you.
Yes, absolutely, you are, on the DrNurse Game, and the idea of have we got it right or are we still playing charades? So yes, very controversial and potentially opening up a can of worms for people.
But hey, let's open that can of worms and see what comes out. Chelsea, what's your background and where are you from?
So I've been emergency and trauma nurse is my clinical background. I still do locum work in that capacity. I lecture and course coordinate at Dunedin School of Nursing, and I'm currently a nurse practitioner intern, so multiple roles. Done a lot of research into horizontal violence in nursing and bullying, so I'm very interested in culture and culture change and why we behave the way we do as groups of professionals. So yeah, that's led to this talk that I'll be doing here.
Okay. Let's open that can a little bit early.
Sure.
So what's some of the worms that you're going to be pulling out for us?
Well, the talk sort of starts about the idea of the DrNurse Game and asks the audience if they do participate in it or not, or even if they're aware of it. So the DrNurse Game was conceptualised in the 1960s, and it was the idea that medicine was the hierarchy, the dominant position in healthcare, and that was because of the education and social status, and that the nursing role was born from a handmaiden perspective. So there was a difference in power, a difference in knowledge, and that caused this game between nurses and doctors where nurses would not openly challenge a doctor, that they would have their very special ways of going about approaching them with their suggestions, and that really the nursing role wasn't valued at all or really understood. So I'm going to be asking people whether they think that's still applicable today or not. Yeah.
And do you find that is still applicable today?
In certain clinical contexts, yes. I think that despite the professional movement that nursing's had and the traction that they've gained over the years from having their own specialised body of knowledge, from all the educational preparation and various roles that nurses do, we still do in some contexts and some relationships have some of those tensions, and it's I think the idea is we're getting more into collaborating and all being recognised as health professionals, but we do still have problems, and I think that if we're all honest, we've all probably had those interesting conversations and experiences. So it's just trying to really look at what can we do differently, and that we all actively choose or not choose to contribute to that.
My perspective from being in the hospital is that nursing role has evolved quite a lot over these years. They have gained a lot of advocacy kind of point of view.
Absolutely. I think that nursing has sort of traditionally and historically it kind of evolved from taking on that holistic health promotion, a lot of interventions that medicine, not neglected, but medicine didn't necessarily focus completely on. I think that that's changing, that medicine is changing, which is a great thing. But nursing sort of grabbed hold of that and thought, right, this is what we do and this is how we express nursing. And now, I mean, the roles are endless, the knowledge is endless. But in preparation for this talk, I actually informally interviewed 6 rural nurses and 6 rural GPs, and I still had themes coming through of I really don't understand what nurses actually really do and what they really know. And another GP that I interviewed actually said to me, in medical school we actually had no information at all about what nurses even know, and how do we even figure out what you guys even know as a group or as individuals, and that really makes it very difficult to work effectively with people, because you feel like you have to prove yourself and prove your knowledge. And so, there's a lot of interprofessional collaboration that could be done to have conversations to sort of reduce some of these problems.
And that's part of leadership, isn't it? Understanding what people's scopes are and whether or not and having the confidence to speak up and say, I don't know this, or I'm not familiar with this. I've done this for a long time, without feeling like
absolutely.
loss of power, really.
And I think that the other thing that we have in healthcare, and it's not it's not just us, but a lot of other industries do, but we do have hierarchy. We have medicine is traditionally a hierarchy model. You've got consultant and then all of the people underneath, and nursing has adopted that as well. And we have hierarchy within our different roles as well. So you've not only got sort of medicine and nursing, but you've also got micro politics between each level, and it's just
it's a big mess.
It is a big mess potentially, but
Yeah.
I'm hoping that by shedding some light on the idea of what do you do and what are you like as a health practitioner, whether you're a doctor or a nurse, and how do you know that you effectively collaborate, will help raise some awareness for people, which is hopefully going to help move people forward.
And do you have some tools? So say I was sitting there realising I don't collaborate at all, or maybe I'm a horrible person and I actually yell at all my nurses.
Or vice versa, or maybe the nurse is just, to the doctors.
Having a hard time myself.
Yeah, absolutely. Yeah, within the presentation there are some theoretical and practical scales and tools that can be used. Absolutely. So, which is just a starting point to get that self-awareness and self-reflection, and it can be integrated into a workplace or just sort of the tip of the iceberg for improving things. Absolutely.
Fantastic. Well, I look forward to the talk. I'll
Yes.
definitely be sitting in the back shouting out a few things. And it'll be interesting to see what kind of worms you can bring out of the can.
I think that, with any of us, whether we're in nursing or medicine, if we're in a position of power, it is hard to look at ourselves. And I think that is the greatest challenge, is to really try and be honest and reflective and be okay if it isn't the best outcome, and that we do need to work on ourselves. I think that may be quite hard for some people, but I'm prepared. I'm prepared.
Might be a hard pill to swallow. And let's not forget the people in the middle of this is the patient.
Absolutely, because it ultimately, if you have a situation where a nurse notices a patient's deteriorating and they feel, apprehensive about picking up the phone and talking to the doctor because of a certain, or speaking to their charge nurse, or not just medicine, but whoever. Of course, the patient's at risk. So, and patient safety and quality of care as well, we're all here. But we definitely could do things a little bit better, I think.
I do have recollections of not wanting to pick up the phone as a nurse. And,
yes.
As soon as you see the doctor walk past, you grab them.
Absolutely.
And now at the turnaround table, being a doctor, I get grabbed all the time. So
And I think that we are inherently socialised into our roles in our educational facilities, and certainly I know in the School of Nursing that I work in, we certainly do discourage that fear and do put out there the professional responsibility and moving beyond that and giving people the tools to feel like they can collaborate and just speak normally, because we're all people, So I think that it is going to be interesting and hopefully of some benefit to people.
Awesome. Well, thanks so much for coming along.
No problem. No problem at all. Nice to meet you.
See you at your talk.
Thank you.